Okay, I think it's a lockdown week 4. Hope everyone's well. So I'm live on Facebook and Instagram again. I've got 2 cameras here in front of me, but I'm going to focus on the audience on Facebook today. Hi everybody, I hope everybody had a lovely Easter break. Hi Kevin, I hope everybody had a lovely time with family. I hope everyone is well. So we're going to get started in a couple of minutes. Hi everybody on Instagram. So just a couple of minutes and we'll make a start. Just a quick update. So I'm only doing one Facebook Live this week, and that's today, and then I'll pick it up again next week. Thank you for everybody who's emailed me. I've sent over 3 chapters from the previous Facebook Live events in a PDF. If you have not received your email and you did give me your email address, please check your spam folders. Yeah, so I've sent out 3 emails with 3 different chapters. So you should have received everything. If you'd like a copy of the PDFs from previous Facebook live events, then please drop me an email in the comment box. Just pop your email address and I'll get that across to you, no problem at all. Great, we've got quite a few people on Instagram as well. So hi everybody on Instagram. I'm just also on Facebook Live, and that's where my eyes will be focused. I'm not ignoring you, I'm trying to get to cover and help as many people as possible. So I'm on Facebook and Instagram Live. So guys, today we're talking about pterygoid implants. I'm going to tell you what is a pterygoid implant and then give you 5 keys to achieving success with pterygoid implants. So give it another minute or so and then we'll make a start again. If you're on my mailing list, you'll get a copy of this Facebook Live event in a PDF format. Okay, so just another minute or so. Any questions, please pop it in the comment box. Happy to take questions. Okay, great. So I think we've got a few people in now, so we'll make a start. So what is a pterygoid implant? So a pterygoid implant is an implant placed through the tuberosity and engages the D1, D2 high quality cortical bone of the pterygoid plate. And it was first described by Telazny, and that's what's from the literature in 1989. So it's been around, a pterygoid implant has been around for a long time. And what we're able to do by placing implants through the tuberosity and engaging the pterygoid plate, that hard cortical bone, we're able to get good stability in our implants. And hence I use it a lot in my full arch implant cases. So today I'm going to talk about 5 keys to achieving success in placing pterygoid implants. First of all, patient selection. Second, anatomy. 3, the equipment you use. 4, the implant you use to play, in the pterygoid region. And 5, your technique. So I'm going to say them again. Number 1, patient selection. Number 2, anatomy. Number 3, the equipment. Number 4, the implant you use in the pterygoid region. And number 5 is the technique. So let's start off with 1, patient selection. So important. So remember, pterygoid implants are not just limited to full arch cases. You can use them in short spans because a pterygoid implant offers a solution alternative to a sinus lift. So you could potentially have, if you've got a pneumatized sinus that's pneumatized around the molar and second molar region, you could potentially place an implant at the back through the tuberosity, engage the pterygoid plate, and an implant in the premolar region, and you could give the patient a bridge. So it can be used in full arch and in short span bridges. So what type of patients are getting pterygoid implants? So one of the big things and the main reasons I use it is to avoid a distal cantilever in my full arch bridges and maximising the AP spread. We know there are issues with having a distal cantilever on full arch prosthesis, and we can eliminate that by placing a pterygoid implant. Also, there are patients that have wide smiles. So when they smile, you can see all the way back. Now, we don't want to just give them a long cantilever. So by placing pterygoid implants, we can give them teeth, maybe if required, up to the second molar with pterygoid implants. Okay, so what else? We need to check the patient has adequate mouth opening. So minimum 45 millimeters, but ideally 50 millimeters of mouth opening. And that's one of the sort of prudent things you should be assessing on patients at the time of assessment and recording the patient's mouth opening, because you're working so far back in the mouth and you need good access. You need to get into with your instruments, and you want even with the multi-unit afterwards when you're restoring, so record the mouth opening, and if mouth opening is limited, don't go there. Number 3, and when we're talking about patient selection, is you've got to have good amount of bone in the tuberosity region. So that's width and height, because the implant has to pass through that tuberosity to engage the plate. So first thing, patient selection. What type of cases are we placing pterygoid implants in? We're assessing patient's mouth opening, and we're making sure they've got enough bone in the tuberosity region. Moving on, anatomy. So important that you're aware and understand the anatomy in this region. I heard someone mention to me, the best way to describe a pterygoid implant, it's simple surgery in a complex territory, and it's very true. It is a complex territory. So you have to understand that the pterygomaxillary complex is made up of 3 bones. Be aware of where the greater and lesser palatine vessels are. Also, you've got to have an understanding of where the pterygoid venous plexus is and the palatine artery, because these are all structures that you are potentially close to when you're placing pterygoid implants. So we've covered patient selection, we've covered anatomy. The next thing to cover, which is really important, is the equipment that I use when we place pterygoid implants. So I commonly use Versa drills because they're tapered. I can use them in reverse, and they osteodensify the pure quality bone in the tuberosity region. I also really like the stepwise increments that the drills go up in. So you get a pilot drill, you get a 2, a 2.3, 2.5, then it jumps to 3. So it's really, a nice, gentle gradation of drills. They're a tapered design. So Versa drills are really useful. I also would recommend using an Anthogear. An Anthogear is a handheld variable torque wrench. What you can do is, from outside the mouth, you can torque your multi-units, working far in the back, far back in the mouth, and reduce the risk of dropping anything down the patient's throat. The other thing that really helps is when I do a pterygoid in the right side, I use a straight handpiece, and then when I do a pterygoid on the left side, I use a contra angle handpiece. And where I stand differs. So on the right, when I place a right pterygoid, I'm to the right side of the patient, and when I do a left pterygoid, I'm at the top of the head position. I'm right-handed as a surgeon, and certainly that's what I found easiest. So those 3 things: the variable torque wrench, the drill you use, the Versa drills, and the straight handpiece really make a difference. 4th thing, implant design. Really important. You want to use an implant that's tapered. It's got an aggressive thread design. It comes with a carrier, for safety reasons. One of the risks that you may have with placing a pterygoid implants, that you could lose the implant either into the sinus or into the infratemporal fossa, and having a carrier gives you that safety net. So have a tapered implant with a good thread design to get stability, comes with a carrier, and offers prosthetic flexibility. When I learned to do pterygoid implants from my mentor, I used Biohorizons implant system, and that's what I continue to use. And for me, that is an excellent implant to use in the pterygoid region. Okay, lastly, technique. Flap design, really important. You want to have a good flap that's fully expose the bone in that region so you've got good vision. Because you're working far back in the mouth, you're working with potentially small instruments, you need to have good access. And again, that's why it's so important that you've assessed the patient's mouth opening when you're assessing before you've started the treatment. So good mouth opening, raise a good size flap, respecting the associated anatomy. And it's not just you as the clinician that needs to be aware of where the anatomy is. Your assistant also needs to be aware of where the relevant anatomy is, because they're going to be retracting the tissues. So good flap design. Now what we're doing is we are aiming our drills from a buccal palatal. So we're starting just buccal to the mid crest, and we're aiming buccal palatal mesiodistal, and an angulation of around 70 degrees. Now it's very hard to sort of illustrate that. It's very hard for me to illustrate that just sort of chatting to you, but just begin to start to get that in your head. You're going from buccal palatal mesiodistal at an angulation of around 70 degrees to the occlusal Frankfurt plane. Okay, so that was my 5 keys to achieving success with pterygoid implants: patient selection, the anatomy, the equipment, the implant you use, and finally the technique. I hope that helps. Any questions, please let me know. I'm just going to go through. Great, we've got a lot of people watching today. I hope you found that helpful. It's just a quick introduction. I am fortunate I am involved in teaching pterygoid implants with my friend George, and he runs a hands-on course on models and cadavers. And once this is all over, then I'm sure we'll have dates for that course. And what I would say from my experience, it did take me maybe 12 to 18 goes. It's very much, it does take time to pick up the technique for doing pterygoid implants, but try it, with the appropriate training. Try it out, because if you don't get the stability with the implant in that region, what's where you just kind of, just remove it and close up, and then you can potentially try again a future date. There's nothing lost, and maybe try it in cases that you getting the good stability isn't crucial. I do have, someone's asking me for pictures. So I've done a number of webinars on pterygoids, and I also have some more upcoming webinars and where I highlight cases, and I have some really good pictures. So I'm happy to, I'd encourage you to sort of sign up to the webinars. They're free. I've done webinars with BioHorizons. I'm doing a webinar with the Full Arch Prosthetics Facebook group. And I go through cases, etc. Any questions? So I'm just going to have a look on Instagram. Thanks for everybody for your kind comments. Okay, I don't think we've got any questions. As I said, if you'd like those 5 keys written out in a PDF, then I'm happy to share that with you. Kevin, are angles and multitude the same for all implants? Yeah, I sort of mentioned, I suppose it's relevant. I can only give limited information here, but I suppose I should say, and one of the important things why I use BioHorizons implants is it offers prosthetic flexibility. I can use a straight, a 17 or a 30 degree multi-unit, and you will need to angle correct when placing a pterygoid implant. If you place a tuberosity implant, then you may get away with placing a straight implant, a straight multi-unit on top. So you do need to angle correct. The beauty with the BioHorizons is a Zimmer connection. There's that flexibility that if you needed a multi-unit that was maybe a bit more, offering a bit more of an angle correction than 30 degrees, then you could potentially source that from somewhere else. Okay, so also everybody, I will post this video onto my YouTube later on today. Everybody stay safe. Thank you everybody tuning in. Okay. Yeah. Thanks. Take care. Bye-bye.